My name's Eileen Beard, and I am a certified nurse midwife, and I currently work for the American College of Nurse Midwives. But I've been a midwife since 1977. It's a beautiful journey. I'm the senior practice advisor, and basically I serve the members. I answer practice questions. I'm in the Department of Professional Public Policy and Professional Affairs, and I basically serve the members, and I've been able to use a lot of my experience in being in clinical practice to assist with practice questions, and I represent A.C.N.M on a lot of committees at a lot of meetings, and I write for Quickening, the quarterly journal, and help in any way I can. I've also been very involved the last couple of years in the annual meeting and with the program committee, and so they gave me a separate job working with the exhibitors, so that's been kind of fun because that brings a lot of revenue into the organization, so it's very important. Even though it's not particularly using my midwifery skills, it uses my skills in that I talk to prospective exhibitors about how midwives can use their product, which gets them to come to the meeting, which brings revenue in, so that's a positive thing. Well, that's sort of the end of my journey story. I'm also a family nurse practitioner, and I was in a job that I was miserable. It's the only job I've really ever disliked. I was working in one of those retail health clinics. I wasn't doing midwifery, which is part of my story as to why I wasn't at that point in my life. I was having dinner with a friend, Tina Johnson, who is the director of professional practice at A.C.N.M. She was also my student. So she told me about this job opening and said that I would, be a good fit. So actually my former student is my boss. That's interesting, and it works well. I mean, we work well together. She's very good at what she does. I opened the first birth center in Maryland, and that opened in 1981. And we were open for 27 years. And I also opened a second birth center. And when I had my birth center, I was a preceptor for students for 27 years, which I loved, and I miss terribly working with students. We also had hospital privileges. I've had privileges at a variety of hospitals throughout my career. So Tina was one of our students. She was a very good student. And when she finished, we offered her a job. And so she worked there until we closed. We closed after 27 years because third-party reimbursement was going down and liability insurance was going up. And the last couple years of my career at the Baltimore Birth Center, I worked without any salary to keep the birth center open. I might get emotional during this interview, but anyway, it was a tremendous financial burden to my family, so we had to close. Towards the end of working at the birth center, I went back to school and got my FNP. So I was also a family nurse practitioner, which I had intended to incorporate into my practice at the birth center. But when it was clear that we could not stay open any longer, I worked as a family nurse practitioner for a couple years, and there's actually more to that story. When the Baltimore Birth Center was open, we opened a second birth center, and that is still opened and has delivered well over 1,000 babies and is thriving and doing well, and I'm very proud. That's my biggest legacy, and I'm very proud of those two birth centers. When I closed my birth center and I got my FNP, at that point I had my master's and 2 advanced nursing degrees. I had my CNM and my FNP, and before the birth center closed, we had a bad outcome on a baby. I wasn't at that particular birth, but anyway, the midwife got sued, and because I was the owner of the birth center, I also got named in the suit, and not that anything was done inappropriately, but anyway, had a terrible time getting liability insurance as a family nurse practitioner because I was a midwife and I could not find anyone to hire me. I eventually found someone to hire me as a family nurse practitioner, but my liability insurance was like twice as much as everyone else's. So, and it remained that way the whole time I was a family nurse practitioner, despite the fact that I wasn't practicing as a nurse midwife. So that was a huge challenge during my career. At one point, the Board of Nursing said, well, if you just don't have a midwifery license, it won't be a problem. But I worked too hard to become a midwife, and, I cherished that. That was like my calling, and so there was no way I was going to not be able to call myself CNM, even if I wasn't practicing as a CNM. And so even when I worked as a family nurse practitioner, I had all that midwifery background. When I opened my birth center, one of the things that we did was provide gynecological health care for women with special needs, and that was a huge thing. That's a highlight of my career, because this is a population that they just had gotten horrible care. And these are women that, many of them were difficult to look at. They were severely physically challenged. Some of them, their body was all twisted up. They couldn't speak. Some of them had no vision. And we were able to take them up into the birth rooms and do their gynecological exams in a very safe, sensitive environment on the bed. And when I became a family nurse practitioner, I interviewed with a very dear man who cared for people with special needs. And my background, my gynecological background in caring for people with special needs, transferred over to that practice. He had a huge commitment to that population. So that's like something that I miss, and is something that I really cherish, and hope those people that I served are still getting good care, because there's a really big gap there. And we're uniquely suited, I believe, to care for that population, because we are so sensitive and we're flexible, and because the hallmark of midwifery care is listen to women. I mean, I was able to transfer that when I was seeing men with special needs when I worked in internal medicine. It was just everything, all the principles were the same. We even put a ramp in at the birth center for people, make it wheelchair accessible. I was involved in, thousands of births. One of them that really stands out was a young woman that we provided care for at the birth center. She was about 14 or 15, which was we saw a very diverse population, but she was, I would say, not our typical client. She'd been a young woman who'd been in foster care her whole life. She'd also had a history of substance abuse, although she wasn't abusing at the time we saw her, at least I believe she was not. She was a very sweet young woman. We did take Medicaid at the birth center. We were very committed to that. And so she did come to us, and we decided to attend her birth in the hospital, because she didn't really have a home environment to go home to. She was giving up her baby for adoption. And I wasn't the midwife on call for this particular birth, but the story of her birth is very special to me, and that is that the midwife who was with her stayed with her for 14 hours straight, which that in itself is not unusual, but she walked the halls with this woman for like hours and hours, as her labor progressed. She didn't have any medication. She didn't have any intervention. And this is a person who never really felt like she'd accomplished anything in her life. She'd never felt like she achieved anything. I probably will cry at this story. She birthed her baby, and she looked up at the midwife and she said, "I did it. This is the first thing I've ever done my whole life." Sorry. So that's like, I still remember her. And about 2 years ago, she called me up, and she's married, and she has kids. And she said that her birth changed her whole life. So that's my best story. And that made everything that I did, all the hardships of not having a salary and not being able to practice at the end of my career, it made it worthwhile. I haven't practiced clinically since 2004, and a lot of that was related to the high cost for me to get liability insurance, and the fact that I probably could have gotten it had I worked in a larger hospital, but I'm a person who likes to work out of hospital in smaller environments, and I just decided to work as a family nurse practitioner. And when this job at the American College of Nurse Midwives came up, I feel like my career has come its full cycle, because now I'm still in midwifery, and I'm able to use my expertise in that respect, although I miss clinical practice. I don't miss getting up at night because I was on call for 27 years. I was fascinated with birth as a child. I'm not exactly sure why. It was nothing to do with the influence of my mother, who never talked about birth at all. It was just, for some reason, it was just something I was always interested in. And when I became a nurse, I had my first baby. I had, my husband in the outside. At that time, that was in 1970. They weren't even letting fathers in the delivery room, so I made a big deal, and they let him in, and that was like this huge thing. They were still doing all sorts of interventive things to women at that time, like prepping them and enemas and all that bad, unnecessary stuff. Yes, episiotomies and stuff. So after that, I taught childbirth education for many years, and in fact, the phone for the Childbirth Education Association in Baltimore was in my house. And I eventually got hired by a physician who was at that time doing something very innovative, and that was he believed that all women should be prepared for birth. So he hired me to teach childbirth preparation classes to all of his patients, and they weren't being charged extra for that. And then he was sending them home from the hospital in 24 hours, which was unheard of at that time. He was a very, very cool guy. And so I did that for a couple of years, and I was attending childbirth conferences, and I met a woman who was a midwife, and I wish I had kept her name, but I didn't. And I was talking to her, and she said she was a midwife, and I said, oh, I've always wanted to be a midwife. I wish I could be a midwife. And she said, well, if you want to be a midwife, you can be a midwife. Just apply to a midwifery program. And I went home, and I applied, and the first year I applied, I did not get in, which was very crushing. But I'm not a person who gives up easily. In fact, I never give up. I applied to a different school the second year. I had a video made of me teaching childbirth education classes. Along with my application, I sent this video of myself teaching, which I was just reminded of when I was here today, actually. Anyway, I got in and graduated. And that time it was a certificate program. So I really took the longest possible road in my midwifery education because I was an RN who graduated from a diploma program, so I didn't have a bachelor's. Then I got into a midwifery certificate program. And at that time, they weren't according a bachelor's. It was SUNY downstate, but it was a certificate program. So when I decided to go back to school, I had to first get my bachelor's, which I did really quickly. And then I did a lot of that online. I was on what I call the once a week course. I challenged out a lot of courses and took the exam online for credit. And so I got my bachelor's, and then I went to Stony Brook for my FNP. So it was like the longest possible route. But what made me think about the film is that Lily Shaw, who's a senior midwife and one of the sweetest people you can possibly imagine, every time I see her at the annual meeting, she goes, I remember that video you made that you sent us. And I forgot about it, but for some reason it stuck in her mind, and it's been since 1976 that I sent it to her. So, not because it was the quality of it was so good, but I guess because not many people did that at that time. But I was determined to get in, and I was going to whatever it takes to make them notice me, I'm going to get into this program. And that was a wonderful experience. I commuted from New York to Baltimore for almost 2 years when my children were young. That was a big challenge in terms of, I wouldn't say it's a regret, but my children often have said they felt like they grew up without a mother because I was away so much. When I finally graduated, then I was on call all the time, especially with the birth center. There was only 2 of us, and there were 3 of us. So one of us was, and then there was a backup on-call person. So I missed a lot of special occasions in my children's life. Now that my daughter is in graduate school, I have 5 children, but she says now that she looks back on it, she has a little bit different perspective, and she sees, you know, that I was doing something important and that I still loved her. But, you know, several years ago, you know, when she was younger, she mentioned, you know, that Mom wasn't there for everything, or she always tells the story of when I was in the first row of one of her shows, and she was on the stage and I was in the first row and I was sleeping. And it was because I had been up all night at a birth, and I said, well, I was still there. I still came. I said not many of the mothers in the audience had been up all night attending a birth, so I think now she's come to understand. I hope my sons do too, but now that they're following their passion, they probably have a different view of it now that they're in their, well, my youngest is 19 and my oldest is 42, so I have a big range to my kids. I think midwives and healthcare providers should be role models. So, and I teach chronic disease to online, and I've always just tried to be healthy because I feel like that's important. Like I would never want to be a smoker and tell somebody not to smoke. Really, the only thing I consistently do for myself every day is every day of my life, rain or shine, I get out and I walk at least once a day. Today, no exception, 5 a.m. I was up. And that keeps me sane, and I believe it helps to keep me healthy, because I've really never taken a sick day for being sick, and I worked when I was pregnant. So I think I've just always intuitively believed that it was a natural process. And I looked around and I saw all the things that were being done to women, and I just knew that it wasn't right, and I felt like I could make a difference. And that was why when I was working with that physician, I felt like I was doing a really good service, but I felt like there was more that I could do. You know, I could give more women more options by being a midwife. I mean, it's not that I should even have to give it to them. You know, I don't even like that term, and I like the term also guiding for birth, because I don't like to use anything that disempowers. I don't like to use baby catcher either, because I feel like we're skilled. But anyway, when I first started practicing in 1977, I was in a hospital setting, and I opened the first birth room in that hospital. And that was just one very small inroad way that I was able to give options to women who were coming to that hospital. It was like we renovated this one room, and although we still were dealing with the culture of the hospital, you know, I was able to, women could get up and walk around. I had a patient carry in a pepperoni pizza during her labor. It freaked out the doctors, but I was fine with it. But even in that environment, there were still many restrictions in the hospital, and that actually gets me to a story about the birth center. There was a head nurse in that hospital who I had met previously, and we used to sit and talk during the night, way into the night, because I was usually there during the night. And we had this conversation one evening, and I said, you know, we're able to give some options here, but this isn't really where birth should be. Women should really be able to be free to be themselves, whatever that means, whether that's dancing during labor, having as many family members, whatever it is they want, because it's not a medical event. It shouldn't be in a hospital. And I'm not opposed to hospital births. I believe in choices for women. So she and I had this conversation. We said, well, why don't we open a birth center? And it was really just that conversation. And 6 months from that date, because we marked the date, we had the birth center open, which was the first one in the state. And it was there that I really felt like I was able to give women, provide the environment for women to be themselves. We had tubs, women could labor in the water, they could walk around in the neighborhood outside, they could bring any food they want, they could bring 50 people. I've heard every kind of music played at birth you can possibly imagine, from hard rock to, you know, I've heard Pachelbel Canon probably more than you can possibly imagine, because that's very common for birth. I can't hum it, but I've heard it. It's strings. It's all strings. It's beautiful. That was a wonderful environment, as long as we didn't have to transfer them to the hospital. because that environment was not welcoming. When we first opened the birth center, we didn't have hospital privileges, and our physician consultant was the one that I had previously been hired to, make the home visits on. And I had no issues transferring a patient to the hospital when he was there, because we stayed and he listened. Just like we listened to women, he listened to me. And when I would call him and say such and such, he would listen and he would respect what I said. He was a really wonderful person. And I remember one time I had a woman at the birth center who happened to be a physician, and she had been pushing, it was her first baby, for more than 2 hours, and she hadn't made any progress at all in pushing. And our protocol at that time said we had to consult and possibly transfer. But the woman in labor said, I know I can push my baby out. I know that I can. I have complete confidence that I can. And I said, well, I have confidence in you, but I still have to consult. And I called him up, and I told him what was going on. And he said, don't bring her. And he said, if she says she can do it, then we need to have confidence in her ability to push her baby out. And she did. And he was wonderful, but unfortunately he retired, and things were never the same after that. And eventually the hospital came to us and solicited us to get privileges, but the environment was very hostile, and it was really difficult. It was a huge professional challenge for me to take someone to the hospital. Not only were the physician staff unfriendly, the nursing staff. Part of that is because most of the people that they saw that we brought in were the patients who were having, I hate to use the word patients, but the women who were having a problem. They weren't progressing. They didn't see all the other normal physiologic births, they didn't see those because they were at the birth center. So, and I remember once coming in with an emergency, and they were saying, they said to the patient, they said to the woman coming in, they said, it's the birth center bringing in a train wreck. And so this, here's this crisis that we're dealing with, and to say something like that, it's highly unprofessional and inappropriate. And it was, when I would have to take someone to the hospital, I would really have to psych myself up to put myself in another emotional state. And I would say to the woman, now we're going to go to the hospital, and I'm going to be with you, and I will do everything in my power to advocate for you. I used to say I would practically throw my body across yours to protect you from any unnecessary intervention. And you might see me say or do things that might surprise you, because sometimes I'll kiss up to people to get something, but it's always just to get what you need. Whatever it is that you need, I'm going to try to get that for you. And I would ask them before we went, what's the most important thing to you regarding your birth? And if they would say, well, the most important thing is that I have Sally and Joe and my husband and XYZ with me, then that would be the main thing that I would try to focus on, because I knew that a lot of the things that were important to them, we weren't going to be able to have once we got to the hospital. They might not be able to walk around, they might have an IV, they weren't going to be able to eat or drink. Hopefully their baby wouldn't be taken from them. But a lot of these things were fights, and they were, in the background, because I wanted to protect them as much as possible. It was very stressful. I believed that I was on a mission. When I was there, I just could block everything out, and it was just all about them. It wasn't about me. And that was hard to do sometimes, because maybe one of my kids something was going on at home. I was dealing with the stress at the hospital, but those things were not important. At the birth center, we had a very large population of Orthodox Jewish women that we cared for. And I'm reminded of this as we're talking. And we had this one woman, she was a very, very sweet lady, and it was identified during her pregnancy that her baby had a birth defect that was incompatible with life. I don't remember what it was anymore, but anyway, so she elected to deliver, to birth in the hospital. And I was very close to her, and I was at her birth, fortunately. And, when we got to the hospital, and she was very modest, she was, besides normal modesty, she was also very religious. When we got there, and she started to push, a whole bunch of people started coming in the room, I guess they wanted to see what this anomaly was, it was, And she couldn't push her baby out. You know, there were like too many people, and I had to ask them all to leave. And once everybody left, and it was really quiet and peaceful, she was able to give birth. Her baby died, but not right away, but like it's things like that, that you look back on and you say, I wasn't able to save her baby because, that was something that happened that was out of everybody's control, but at least I was able to help her to have that little bit of dignity, which was like super, super important to her. She was a beautiful lady. She actually had a complete emotional breakdown at the loss of her child, but there were religious issues, and she didn't have time to grieve for the loss. Of course, you remember all the good things. I don't remember every birth because there were more than I can remember, but the few times when there was an untoward outcome, like a birth defect or you remember those. The one other story that is something that I will always remember my whole life is we had this couple that came to us, and she was Hare Krishna. And you don't hear about Hare Krishna too much now. But anyway, her baby was also identified as having a birth defect. It was anencephalic, which means its brain was exposed. And we, consulted with our physician consultant. There was no reason to attend her birth in the hospital because we knew the baby wasn't going to live. And she wanted to take the baby home with her. And so I was on call for that birth. And she took that baby home, and she fed it with an eyedropper. And I went to visit her at home because we also made home visits on all the women who gave birth. And I know that made a huge difference that she was able to have that time with her baby and nurture that little soul, and that was very special. I'm having all these deja vu, remembering all these different things. We had a woman come to us who had cancer, and she was actually dying, but she was pregnant. And she had an oncologist, and she had a portacath, and she had gotten chemotherapy. I don't remember what she had. I think it was lymphoma or something. But anyway, most people would have considered her very high risk, but she knew she wasn't going to live to see her child grow up, but her birth was very important to her. And we also consulted with the oncologist and said, well, in terms of the birth, there wasn't any reason why she couldn't give birth out of the hospital. It wasn't going to affect her other status. So she gave birth at the birth center as well, and that was very meaningful to her. And she did pass away, I think within about a year of when her baby was born, but at least she was able to have that special time. And I think that, being out of a hospital environment really does make that a lot easier. You can certainly have a wonderful birth in a hospital, but I think when you're at home or at a birth center, you have so much more flexibility to make it a more comfortable environment, And it's very exciting to see that we are making a lot of progress, and that things are changing, even though the cesarean rate is much higher now than when I was in practice. At the birth center we had a really low cesarean birth rate. And we didn't induce people. It had to be really a rare thing. But I'm hoping that changes during my career. But there's a lot of good things that have changed. We're partnering and reaching out more, and a lot more collaborative efforts. Well, I think, there's enough evidence that's come out now that I feel very comfortable then and now, even more so now because there's more evidence with the birth center study that's come out and everything, that out-of-hospital birth is as safe or safer than in a hospital with a well-qualified attendant in a healthy woman. I don't have any reservations about saying that. I'm very comfortable with it. Again, it's not a medical event. I think, in hospitals, you should stay out of hospitals unless you want to give birth in the hospital, which is fine. I totally support that choice. Or if you're sick. Otherwise, pick the environment that's the most comfortable. If somebody came to me when I had the birth center and said they wanted to deliver in the hospital, I would support that. Or if they said they wanted a home birth, although I didn't attend home births, I would completely support that and send them to someone who, a qualified person who did a home birth, attended home births. So I'm very comfortable, and I'd like to see more and more birth centers opening, and I support options and choices for women. I think that's what it's all about, just listening and presenting things in a way to women so that they really are active, informed, educated consumers that are fully participating and directing their care, and that we're guiding and overseeing them in this beautiful process, and helping them to have the birth experience that they want. Because I'm sure you can interview somebody when they're 90 years old and they may not remember very much, but they will remember their birth. And I might add that I had my last 2 babies at the birth center, and my last baby, I was 46 years old, and I had my birth at the birth center. And although I'm a tiny little lady, my babies weighed almost 10 pounds, and I had a normal physiologic birth with a nurse midwife. So you have to support, not only care for women, but I was a consumer of midwifery care and would always be one, because I do believe every woman should have a midwife. We used to say at the birth center that we provided woman-to-woman analgesia, because I would never tell someone that they're going to have a birth without pain. I mean, I personally think for most women there's pain, or you can call it discomfort, you can call it pain, but it's sort of good pain. Something good comes at the end. There's so many things that you can do. There's so many underused interventions, such as birthing in the tub, makes such a huge difference. Having support and being able to walk around. I mean, epidurals have their place, but I believe one intervention leads to another intervention. And so I think you get the most pain relief by having the support and being able to eat or drink, walk around, and being in a peaceful environment where, whatever kind of environment is best for you. I remember once I had a student with me at the birth center, and we had a very large family with this woman who was in labor. It was like 10 people in the room. It was really noisy. And the student turned to me and she said, "Make them be quiet. It's not a good environment." And I said, "No, but this is what she wants. She picked this. This is how she wants it." Because I had talked to her about it ahead of time. I said, "Do you want to limit the people in the room? Do you, whatever you want, just let me know." So, because sometimes women in labor would ask me to say, "I don't want my mother-in-law in the room. Would you ask her to leave?" So, whatever she wanted. I think that having the support, having your back rubbed, being in the tub, having your loved ones and whoever you consider family with you, whether that's your sister, your brother, your partner, whoever it is. I once had a woman and her partner and about 8 other women at a birth all surrounding her. That's what she wanted, and that was beautiful for her. And that helped her get through that labor and birth. I think opening the first birth center in Maryland, I was also the legislative chair when we got prescriptive authority, opening a second birth center and caring for people with special needs. Those are the things that I cherish the most and will always cherish. They're like dear to my heart. To me, the heart of midwifery is the respect that midwives have for the normalcy of birth and the energy that they put to educating and providing an environment for women so that they can be themselves, and supporting the normalcy of the birth process. Because sometimes in this country, that's not so easy to achieve. I didn't want to be a downer, so I didn't talk about all my liability struggles, but that I had a lot of struggles with that. Not because we did anything bad, but just because right before the birth center closed, I had a bad outcome, and then another midwife had a bad outcome. Just coincidental. We were open for 27 years, and that basically just made it impossible for me to practice after that, just because my insurance was so high, not because I got sanctioned or did anything wrong. I mean, they were completely unavoidable. I believe that. It's a lot better now. If I were in practice now, I don't believe I would be in the same situation. Back then, you know, it was like you didn't talk about it. There were no support systems. It was at the height of the liability crisis. So that made it. It was just like timing. I don't know if I really overcame it. I mean, honestly, it was like I had to see a therapist. I mean, I was like, you know, getting sued it's like horrible. It's a horrible thing, and it like dragged on for many years. Well, I can tell you this. I never let it change what I did. In other words, I didn't do anything that I shouldn't have done. So I didn't let it frighten me so that I restricted someone from, in other words, I didn't say, oh, well, this woman had a bad outcome from a VBAC, so I'm not going to do VBACs. Because I knew that that was the exception and that everything was done correctly. I would say it made me inside a little more frightened, but I tried not to ever transfer that and limit options. And that was an internal struggle that I went through. And I think at the end of my career, because of those two things that happened when the birth center closed, I started to feel frightened. And I said, if you feel frightened, although a little fear is good, I used to tell my students, if you don't have any fear, because you want to keep on your toes, but probably it's time not to practice anymore, because you don't want to transfer that to anyone else. You know, now that all this time has passed, I probably have gotten past that, but of course I haven't practiced in a while now, and I'm 65, so I'm not looking to take call at night. But it's never, ever changed my view about birth. Never. And it never will, because I believe in it with all I believe it's a normal physiologic process, and anyone that will listen, I will tell them that. There's no reason to go to an obstetrician for your care if you're a healthy woman, and that midwives provide primary care for women throughout the life cycle. So you don't need to just be pregnant to see. You know, women in my age group that I meet, when I tell them I'm a nurse midwife, I always get the same response. Oh, I'm too old to go to a midwife. And then I have to go through my whole thing. So I don't always bother at this point because I know I'm not going to change their mind. But if I see anyone that I think is an audience that will listen, because although I'm a family nurse practitioner and I tell people that, I identify as a midwife. I mean, that's really the essence of who I am and who I always will be. And that will never change. And I thank you for the opportunity to tell my story.